Hoag, what kind of capability do we have at Hoag?
So we have a number of ways that we can address brain metastases. Gamma knife radiosurgery is a great device and method for treating brain metastases. It's a machine that has 192 radiation sources that can all be focused in on a focal point. And in this way, we can give a very high dose of radiation that is very limited in its volume. When I describe this to patients, I commonly make an analogy of playing with a magnifying glass in sunlight.
Sure.
And we probably all have experience with this where you can make it hot enough to burn paper at that focal point, but just a short distance away, it's like harmless sunlight. So the gamma knife works in the same principle, focusing the radiation to give a very high dose of radiation to each individual tumor. And fortunately, brain metastases grow typically in balls that displace the brain. So we can treat with a very narrow margin because they don't tend to infiltrate very deeply into the brain. And the volume that we treat is basically all tumor. And that makes the gamma knife a very tolerable treatment. In addition to that, we also have, for larger brain metastases, our newest radiation machine in the department here, the ViewRay. This is a combination of an MR scanner and a radiation machine or linear accelerator.
Wow.
And this is a machine that has the capability of doing an MRI with the patient in the treatment position right before treatment, and the capability to adapt the radiation plan to the conditions of the day. So if anything has changed, we adapt the radiation plan to what we see. We're also able to run a continuous MRI scan during treatment. And in that way, we can actually see what we're treating as we treat it. This primarily has application in mobile tumors, like things in the lung or the abdomen, where we need to track and we need to manage the motion. But I'm always surprised when I'm trying to apply it within the brain. It can have its uses for very surprising reasons. I could go into some anecdotes if we have time. But this is a treatment that's better for larger brain metastases, which are better treated with lower doses over maybe 3 to 5 treatments as opposed to one single dose of radiation, which for larger tumors can cause a swelling reaction.